Welcome to this podcast series, and we're here to talk about scalability and bioreactors. But before we begin, let me quickly introduce myself. My name is Aditya Bhat. I'm the VP of Technology for ABBA. And
I'm Ann D'Ambroso. I'm the Director of Sales and Marketing for the Americas.
I think before we start with our questions, because we're going to talk about bioreactors in a minute, I just wanted to maybe start the conversation slightly informally to ask about your own experience with bioreactors in the sense that before you started working for a bioreactor manufacturer company, were you exposed to bioreactors before then?
Yeah, I started working with bioreactors in grad school. So I
Mm.
was operating 10 liter and 15 liter with yeast and then E. coli. So I got experienced hands-on operation with big glass bioreactors.
Mm. Okay. And were you drawn to them, or did you find?
Yeah, it was very interesting to, go through all the careful setup and then get the data from a bioreactor run.
And then you've obviously joined a company which manufactured bioreactors, and I'm guessing there's a lot to. So, as a user of a bioreactor, you probably are exposed to quite a few things, but as a seller or supporter of bioreactor instrumentation, that's a whole new ball game, isn't it?
Yeah, it was a good fit for me because I liked the idea of helping people learn how to use the equipment. And actually, that was part of my role, even in the lab that I was working at before, because I had bioreactor experience and was in a group where not everybody did. I was kind of playing that role already. But yes, I learned a lot more about different ways of using the bioreactor actually when I joined the commercial side because I had previously just worked with organisms that made plastics. And there's many, many, many biopharmaceutical and biotech applications, obviously, and a bioreactor is a very generic piece of equipment in a lot of ways because it can grow different cell types if used in different ways. It was PHA work.
We have spoken
Yeah,
about
yeah,
it.
yeah.
That's right. Yeah. So my PhD work was with PhDs as well.
Yeah,
Oh,
yeah.
that's amazing. Okay. Okay. So yeah, of course we're here to talk a little more about scalability, and we want to talk about ABBA's approach to scalability, and how our offerings are sort of addressing that challenge that our customers often face. But we thought before we even get to that topic, we should talk about or establish what scalability is.
Sure.
And we cannot talk about scalability unless we talk about bioreactors.
Yes.
So, being that you're now our in house bioreactor expert, can you tell us what is a bioreactor for those? I'm sure many of us are, of course, aware of it, but it's good to start with the basics. What is a bioreactor, and why do they come in different sizes?
Yeah, so a bioreactor at the most basic level is a sterile closed vessel that can cultivate cells in approximately a homogeneous environment. So that often looks like a stirred tank because stirring helps make things homogeneous, but it could also be a packed bed or a rocking motion style bag. Those formats are variable, but the other variable is the size of the bioreactor. And really, that's all about how much capacity you need to make the product of interest or do the experiment that you're trying to complete. So, the smallest bioreactors these days are just a few milliliters, for example. Obviously, you can go up to thousands of liters. So, those different size ranges do come with some different considerations as well.
So you mentioned homogeneous, right? Like, so one, I guess, function of the bioreactor is to keep everything in there homogeneous and well mixed. Why is that important?
Yeah, that's exactly right. Even I would say the most straightforward bioreactor is holding pH, dissolved oxygen, and temperature as a constant. And that's because those parameters are quite critical to how a cell grows or produces a product. So you're trying to optimize those conditions for the cell type that you're using and holding that at an ideal set point during a bioreactor experiment.
So I think so. You mentioned a few scales, but in the very small scales, it might be typical to use shake flasks, for instance, where you cannot control these parameters. So does that, how does that sort of inhibit the process if it does?
Yeah, it will limit to a certain extent um, how optimal it
Mm-hmm.
is. So, for example, in microbial growth, the cells go quite fast, so they might be oxygen limited in a shake flask, or they might run out of carbon source at higher densities where you've exceeded the carbon availability or the oxygen level. They might make more acids, and therefore the pH will drift down as well.
Mm, right. So you mentioned different types of bioreactors as well. Uh, it's probably worth mentioning that there's now single-use bioreactors too. Maybe a quick word on those two.
Yeah, so traditionally glass and stainless steel were used in bioreactor processes because they could be sterilized with heat.
Mm-hmm.
There's now the motion towards single use to use a vessel that's basically sterilized with irradiation
Mm-hmm.
or maybe even X-ray.
Mm-hmm. Mm-hmm.
So the idea there is you still need a sterilized vessel. Single use makes the setup much easier because that sterilization has been done by the supplier rather than the end user. And that makes it more quick and kind of foolproof to set up a new experiment.
Mm-hmm. So I've often heard our customers say that a bioreactor is typically without sensors or without any PAT measurement. A bioreactor is just a box or a bag.
Mm-hmm.
So I assume that when we're talking about the different scales of bioreactors, whether it's reusable, single use, it is equally important for PET technologies to be applied to these different scales as well.
Yeah, exactly. To do more complex bioprocessing, you need additional sensors and additional control mechanisms.
Mm.
So, in today's biopharmaceuticals, for example, quality control requires very tightly controlled processes. And there's cost considerations. The more productivity you get out of a bioreactor process, the lower cost the final product will be. So there's a need for better optimization to accomplish those goals. However, that might look slightly different in the scales that you're working at. So you need to have basically equivalent capabilities
Mm.
in the small bioreactors where you're often doing your process development and your large bioreactors where you're moving into manufacturing.
Right. Okay. So now let's talk about those scales, right? So why do you start with typically such small scales? Why don't you just start with a production scale bioreactor?
It would be nice if you could run your bioprocess and get the exact result you wanted in the first time, but
Yes.
science doesn't work that way.
Yes.
So the reality is that smaller bioreactors are less labor to set up.
Mm-hmm.
There's less cost from media or other resources that are going into the bioreactor run. And they take up less footprint in a space in the lab. So you can use a smaller lab space to run more small experiments if rather than a few number of large
You
experiments.
can do more trials, more yeah,
Yeah, and
yes, yeah, yeah.
exactly, with any type of experimenting, you need to test more conditions to determine what's the best one. So that means running more bioreactors.
Okay. And then I guess that's what scalability means, which is to go from a small scale to the large scale and have it. So let's talk about that. What does what from that perspective, what does scalability actually mean?
Yeah, so like I mentioned, in the small scale bioreactor, you're very often doing some sort of process development or optimization of the monitoring and control of the bioreactor. In order to scale up successfully, you want to run that same successful or optimal process in a larger bioreactor.
Mm-hmm.
That sounds quite straightforward, but the reality is
Yeah.
it often is not.
Mm.
And that's because you might not have exactly the same equipment in both size bioreactors. Some things don't increase linearly, such as oxygen transfer rate or
Mm.
temperature transfer rate. So there's a need to match as many of the capabilities as you can and then do further experiments to kind of prove that you've scaled the original process into that larger vessel.
So what are the indicators that your scale up process has been successful?
So that's where sensors really become important. You are often collecting a lot of data
Yes.
in modern bioreactor experiments. At the very least, those data points act as a fingerprint for your optimal process. So for pH and DO, it might just be maintaining a set point, but for other sensors like glucose concentration or cell biomass density, you'll see a fingerprint of that over the course of the process. Or you'll find that you are also able to successfully control that at a set point by using sophisticated process controls at both scales.
That's very, very interesting. And so when it comes to pH DO, you said that it's not just monitored but also controlled, typically. And we know that mostly these are done in real time with inline sensors. With biomass, it's also measured almost always, but often enough, it's measured offline. So when it comes to scale up, right? You said there's so much data that we now tend to collect, and you want a fingerprint, a real time fingerprint of the process. So do you think the offline method of measuring VCD could be limiting to this to assessing your scalability?
Yeah, there's definitely going to be a couple of problems with an offline data point. It's based on users being available. So the timing
True.
of the people in the lab is maybe not perfect every time. There's also the preparation of that sample. And there's then, because of time availability, there's going to be gaps between the data. So you might not have a complete picture of how the bioprocess proceeded.
And like they say, cells don't take weekends.
Yep,
They're
they're
good
going to grow
if
the
you.
whole time.
Yeah, exactly.
Hopefully, unless they've died, which would be sad.
Uh, yes. Okay. Yeah. No, that's another good point, which is often enough, especially in cell culture, you are limited to taking a sample once every 24 hours, and if there's a weekend in the middle, unless you have a very let's say willing to please intern, you probably have data for 5 days and then a 2 day gap.
Yeah, or you have shift work.
Or you have shift
Yeah,
work. That's right.
exactly, which is just demanding on the staff.
So we've spoken about bioreactors. We've spoken about why they come in different sizes and forms. We've spoken about the challenge of scalability, or rather, why can't you directly jump into a large scale bioreactor? You've got to develop your process from smaller scales and then move to large scales, and how that poses a bit of a challenge because not the cells don't grow in the same fashion in each form factor or volume. And that's where we also brought in PAT technology. Just a sort of a very quick word on PAT technology as well, because the FDA, I want to say in the early 2000s, came up with the term PAT, or process analytical technology tools. And essentially, what they said was that your bioreactor cannot be a black box anymore, and that you want to measure those parameters in particular that are critical for your process in an important way. I believe they defined critical process parameters that impacted the critical quality attribute, or the CQAs of the process. So, speaking of those PAT technologies, you want to use them across different scales, of course. But how can scientists and engineers be confident that those PAT technologies are actually working the way they should be across scales?
Yeah, so it helps if any part of your process can be kind of tested or validated before the beginning of a run. And that's something that's often part of the bioreactor setup. So you might, for example, do a pH calibration before you sterilize, or in the case of single use, have a certificate that says that the built in sensor is ready to use. If there's other ways of simulating the sensor or testing the pieces of a sensor, that can be very valuable before you invest the time in conducting the bioreactor run. The other simple case is that during the experiment, you have indicators that the sensor is working as expected. So whether it starts at the same value as it normally does, or perhaps you have an offline check or a comparable value that you can use at particular points in the process. Usually, what's really interesting about bioreactor processes, although they are complex, they should, when well developed, look as you expect. So that's where, to your point, the PAT initiative set by the FDA is about collecting all of that data so that there's a much greater understanding of what's happening in the critical process parameters and that you're getting the high quality process that you expect because everything matches the developed procedures and the fingerprint that you're used to seeing for the data that you're collecting.
I imagine that becomes even more important in manufacturing scales, right? Because here you're talking about massive volumes, high cost of running a bioreactor. So if something were to go wrong with your run, you've got to be able to trust that PAT measurement. Because if something were to go wrong, then you have two questions in front of you. Has my process gone wrong, or is the PAT measurement actually incorrect? And I've often seen many of our because manufacturing is all about sort of risk management. It's not uncommon to see redundant sensors being
Yeah,
used, right?
exactly. I was going to say the same thing. For the most important measurements, it is common to see redundant sensors for that exact reason, to show that they're aligned with each other, which gives you greater confidence in that reading, but also to serve as a backup in the sense that one sensor might fail, that the run, which depends on it, can continue.
Excellent. So, would it be a fair comment, Anne, if one were to say that a good PAT technology is one where the technology itself is scalable, that it's available in different forms, so you can use it across different bioreactor volumes, form factors, single use, reusable, etc., but also one that can be used by the scientists and engineers to validate whether their scale up process has actually been successful.
That's right. You want to be able to use as many of the same technologies at both the small scale and the large scale so that you have assurance that when you've taken that bioreactor process into a larger volume, it is of the same quality and outputs
Yeah,
that the process was in the smaller volume.
excellent. I think we've covered it all. I think that's great. I think we've covered bioreactors, scalability, PAT technology, and how it can be used to validate your scale process scalability.